Bespoke Dental Implant Clinic, especially if you're coming to see myself, if you're in pain, there's a lot that we have to offer. We are very different to an NHS emergency setting. We can provide comprehensive treatment, permanent treatment, normally there and then on the day. If you have a broken tooth, it doesn't always need to be removed. We spend a lot of time trying to help rebuild the tooth, perform root canals, place a post, rebuild, crown, provide a temporary crown. If you fractured your veneers or your crowns, it is deemed advanced treatment. So just take a moment to think, hey, which dentist am I about to go see? What type of advice am I going to get? As long as you're not in too much excruciating pain, hopefully you've got time to get a second opinion. It's so important. And you find that if you don't get the right treatment the first time, it comes back to haunt you and it ends up costing a lot more at the end of it. So I think just take your time. If you're in pain, just read up on the NHS website, read up about the advice, what to do when you're in pain, such as taking over the counter medication. Please don't overdose. Seek some advice. Many dental practices are available to give advice over the phone. Hopefully 111, if they're not inundated, will be able to give you some advice and make a well-rounded decision. Do you want to go to a private emergency dentist, or are you waiting for an NHS emergency dentist? And what kind of service can they offer you when you get to your emergency appointment? Because the last thing you want to do when you're in pain is have a wasted trip or a wasted journey. But sometimes it's better to do nothing rather than do the wrong treatment. And quite often when you're in pain, your decision making may not be very clear. So you need a dentist that deals with emergencies quite regularly, can give you the best of advice, keep it really simple, don't need to make it complicated, and allow you to make that decision. And sometimes the best thing is to actually get intermediate treatment, something temporary, knock the pain on the head, and then buy you some breathing time for hopefully a week or two so you can make a well-rounded decision on what to do next. So if you are looking for comprehensive emergency treatment, more than happy to help you, health permitting, subject to availability. I'm available. I've been doing this for many years and I love doing it, and that's why I do it. But I'm here to offer a little bit more than just getting you out of pain. I'm here to offer you the advice that you need immediately, the advice you need in the long term. If the tooth is coming out, when should you have an implant? What's the alternative to dental implant? You'll get a full, very comprehensive opinion from me. So I do look forward to seeing you. I'm sorry to hear that you're in pain. Please just act fast, but act calmly, and you'll be safe. You're in safe hands with me. You'll be fine. Thank you.